Both consultations are important, online and offline. Ultrasound examination is mandatory. Next day, you can start traveling or you can fly home. Both consultations are important, online and offline. During online consultation, we can make primary modeling of your future breast. With artificial intelligence, you will see how breast can look like after the surgery. We can discuss the asymmetry of your breast, the volume of your breast, and also technique for the surgery. We will choose shape of the implant, projection of the implant, and the size of the implant. It is very informative consultation. After the online consultation, you will have your first invoice with the price for your future surgery. After prepayment, you can choose the date for your future surgery with your assistant. The day before the surgery, during offline consultation, we will make the final measurement of your breast and we will make the final choosing of your future implant, shape of your implant. We will choose technique for your future surgery and we will understand finally the duration for your surgery. Of course, you want to see the results after the surgery, and it is difficult to show breast augmentation mastopexy results in social media nowadays. So the best choice for you will be to follow my Telegram channel. On my Telegram channel, in media folder with the special hashtags, you can see a lot of real breast augmentation results without hidden nipples. And in the GIF folder, again, you can see a lot of results. So I'm starting to use Telegram from 2011. So now there you have more than 2,000 videos and more than 3,000 photos. I have special page also on Instagram dedicated to the breast surgery. So again, Telegram channel, here you can see the link, and Instagram account, here you can see the link. The best choice for you to see my breast surgery results. All of my prices are open in all of my pages, in all of my working pages. Also, my price always open on my website. So you can see the link of my website here, and you can see the link of my working page. On the saved stories on Instagram, you can see pink sphere and with the name price. There you can find all the prices. Before your surgery, I do not recommend you to smoke 1 week before the surgery if you are a smoker. I don't recommend you to drink a lot of alcohol. Of course, the 1 glass of champagne, 1 glass of wine, it's okay, but I recommend to drink less or better not to drink. Also, before your surgery, I recommend you to make the blood test and send this information to us. You can have the list of the examination from your assistant. It will be better for you to know everything about yourself before the surgery. Also, it will be better for us and for the anesthesiologist, because we don't want to cancel your surgery when we will see you 1 day before the surgery. You can plan your visit 2 days before the surgery. For example, first day you do the blood test, you will do the ultrasound examination, you will do the consultation with your anesthesiologist, and the next day you will have offline consultation with me, with your surgeon. And the next day you will have your surgery. The day after you will be free. You can start your traveling or you can fly home. Usually in all countries, in all big and good clinics, all examinations are the same. My assistant will send you the list of the examination that you should do. You will have the list of your blood test examination, and then you will have the recommendation for ultrasound examination. Of course, our recommendation to do ultrasound with our radiologist. During the ultrasound examination, we will check your gland, we will check the position of the muscle, we will check the symmetry of your ribs. Then, when we will have blood test examination, we will have final conclusion about your health, about the duration of the surgery, and we will know with anesthesiologist which medication we should use during your anesthesia. If we will do secondary breast augmentation, secondary mastopexy. Sometimes I recommend also to do CT scan of your chest, but you will know it from your assistant. Now we have a lot of artificial intelligence software which can show you the future shape of your breast, but it will be not the real shape, the real form of your future breast. Why? Because artificial intelligence cannot predict the elasticity of your skin, cannot predict the tension, cannot predict the gravity. So yes, it can show you like more or less the size of the breast, the position of the implants, the position of the breast. It can show you if it will be symmetry or asymmetry of your areolas. Maybe we will need to change the volume of your breast, for example, for the mastopexy or for the breast reduction. But again, you should understand that it will be not 100% the future shape, the future modeling of your breast. On my social media, on Telegram account, on Instagram account, you can see the comparison of artificial intelligence modeling before the surgery and the real result. So I compare like how artificial intelligence thought that it will be and how it was real after the surgery. This information is more important for the surgeon because we can see the difference of the volume of the breast and we can understand more which technique we should use, which texture of the implant, which size, the base of the implant will be better for your surgery. Ultrasound examination is mandatory. You should do ultrasound examination before breast augmentation. First of all, you will know more about your gland. You will know, do you have cyst, do you have fibroadenomas? But gland cyst usually is not a contraindication for the surgery. The same with fibroadenoma. But we should know where they located in. If they will be big, maybe we can treat at the same time during the surgery. Or maybe we should just control these cysts and fibroadenomas in your breast. Also, during ultrasound, we can see the thickness of your skin, the thickness of your gland, and the thickness of the fat tissue. We will see the position of the muscle, and we can see the symmetry, asymmetry of your ribs. It is very important before the surgery to know all these details because it can change the future technique and also can change the choosing of the implant. Maybe we should change the shape of the implant. Maybe we should change the texture of your implant. There are two popular breast augmentation techniques. The implant placed under the muscle or above the muscle. In these short videos, you can see how these techniques looks like. Of course, it's important to know the size of the pocket, the placement of the pocket, to choose the right, correct implant for this pocket. For the last years, I'm using more and more polyurethane, microtane implants with dual gel. And with these implants, I can place the implant above the muscle. But we will discuss the placement of your implant during online and offline consultation. You should understand that muscle doesn't keep the implant. Muscle covers the implant. This part of the implant will be covered only with your soft tissue, only with your gland and fat. So you should be very careful, very attentive to choosing the right, correct size for the implant, because if the implant will be too big, too wide, you can feel the borders of the implant here. With the good thickness of your skin, with the good thickness of the fat tissue, sometimes you can place the implant above the muscle. So after this surgery, you will feel like zero pain because we will not touch the muscle. If you are touching the muscle, if we put implant under the muscle, you can feel the pain, but it will be very light pain. You will use special medications, painkillers, and you will feel normal yourself. Also, I don't use drainages after the surgery. The scar will be very short, usually it's 3.5 centimeters, very thin one, invisible because it's in submammary fold, and it's the most safety zone to put your implant inside. I use the special glue. You don't need to take off the stitches, so just few weeks after the surgery you will remove the tape, you will remove the glue, and you will see that your scar is perfect. There are two popular techniques for the breast lifting. Breast lifting with the implants and breast lifting without the implants. If you have already the big volume of your breast, if you have enough volume of your breast, if you're satisfied with your volume with the bra, you can do the surgery without the implants. So we can put all this volume to the new position with the special technique, and you will have natural breast with the new highest position. Of course, we can speak about the shape, we can speak about the size. Maybe you want to have your breast a little bit smaller, but we can discuss this during online and offline consultation. Now about breast lift mastopexy with implants. I recommend to use the implants if you have ptosis of your breast, but if you lose the volume. Implant will give you additional volume. We will choose the special implant for you. It should not be very big, because with the big implant during the mastopexy you will have the tension on your scars. If you want to have beautiful invisible scar, we should not have the tension. So it should be a balance between volume of your breast and volume of the implant. With my experience, of course, I know which size of the implant will be the best for you, and I know which texture is better to use for you during your surgery. After mastopexy, with implant, without implant, we will not use the drains. No drains, no pain, only skin color tapes for 2-4 weeks, and that's it. This is all your rehabilitation after the surgery. On my YouTube channel, I recommend you to watch the videos where I cut all the implants from all the brands. So you will see that inside all of these implants, they have the same gel. The difference between these implants are in texture of the implant, and of course in size, in the projection of the implant. In my practice now, I'm using more microtain polyurethane implants because they are more stable. They stick with all of your tissues and they don't move. They will not rotate, because I like to use anatomical implants. With anatomical implants you will have beautiful natural shape. I don't like to use big implants. Usually in my practice it's from 250 350 cc the volume of the implants, and I like to use moderate projection, so as much natural breast as it can be possible. This is my vision for the breast. I don't like big breast with big volumes of the implants because it is very dangerous for the complications. So you know that there are round and anatomical implants. During online and offline consultation, I will explain you which shape of the implant is best for you, but 99% it will be anatomical implant. Maybe it will be short anatomical implant, maybe round base anatomical implant, but my opinion, anatomical implants are the best. So the volume of the implant is not the size of your future breast. The volume is the weight of your implant. So if it's 250, it doesn't mean that your size will be, for example, B cup or the second side of the breast. It's the weight. It's 250 grams of your implant. I will explain you much more during online and offline consultation. Don't worry. We will choose the best implant for you. Don't be afraid of our anesthesia. It will be the best anesthesia in your life. It will be the best dream during the surgery in your life. You will have very fast recovery. You will not have vomiting. You will not feel any pain. So relax. Don't worry. But you should understand that there is no test for the anesthesia, because anesthesia is the combination of the medications. Of course, the best clinics, they should have the best medications. There are no secrets in different countries, in different cities, in best countries, in the best clinics, we can have the same best medication, but the best anesthesiologist, like the best barman with the best drinks, will make you the best cocktails. The same for the anesthesia. That's why with our best anesthesiologic team, with our best medication and special, unique, modern anesthesiologic equipment, you will wake up immediately without any pain, without vomiting, and 2 hours after the surgery you are free. You can go to your hotel, or after a few hours you can go to the restaurant. You should know that during your surgery we will use special monitoring of the deepness of sedation. So it is impossible to feel something during the anesthesia. It is impossible to feel pain, to wake up during the surgery. You will see, it will be the best anesthesia in your life. At the same time, with breast augmentation with implants, you can do a lot of surgeries. For example, rhinoplasty, brow lift, sometimes facelift, neck lift, haloplasty. I don't do abdominoplasty, I don't do liposuction, but also if it's small surgeries, you can add it to the surgical list. If it's mastopexy or breast reduction, I don't recommend to do long surgeries at the same time, like rhinoplasty or the facelift. The short one, like eyelid surgery, brow lift, haloplasty, could be. I don't recommend because of the duration of the anesthesia. Yes, our anesthesia is the best. We can do the 10-hour surgery and 12-hour surgery and you will feel yourself very well. But anyway, it's aesthetic surgery, and in my opinion, it is better to divide the surgeries if they are too long. After primary breast augmentation with implants, after mastopexy, next day after the surgery, you're free. Also, 2-3 hours after the surgery at the same day, you can go to your hotel. And if the surgery was in the morning, in the evening you can go to the restaurant. So next day you can start traveling or you can fly home. The main difference between breast augmentation with the implant and mastopexy is after mastopexy you will have special tapes. It will be like inverted T tape. That's it. After primary breast augmentation, I recommend to use compressive bra 1 month during all day and then 1 month during the night. And you can start to use like normal sport bra. You should feel the compression of your bra. You can be without the bra 6 months after the surgery. After breast reduction, after mastopexy, I recommend to use compressive bra 3 months after the surgery. And then normal bra you should use 6 months after the surgery. Why? Because if you want to have invisible scars, we should not have gravity jumping of your breast, the movement of your breast, and we should protect the scar. That's why you need to use special tapes for your scars. After primary breast augmentation with implants, if we used Microtain polyurethane implants, you can start doing sport 1 month after the surgery. Why? Because with this special cover of the implant, this implant will be very stable immediately 1 month after the surgery. The texture of the implant will stick with all the tissues around and it will not rotate or mold. If we will use another texture of the implant, for example Mesmo texture, I do not recommend to doing sport 5-6 months after the surgery. Why? Because this is a percentage of the movement of the implant, rotation of the implant, so it will be not good for you. The main difference between mastopexy and breast augmentation for the sport is you should use special tapes on your scars. You should protect your scars. And you should wear your compressive bra for the longer time. My recommendations, 3-6 months after the surgery. After breast augmentation, you will have small tape on your sub-mammary fold, here, very short one. You can go to the bath immediately after the surgery, 2-3 hours after the surgery. Do not remove it. Also, I use special glue. You don't need to remove any stitches after the surgery. 2-3 weeks after the surgery, you will just remove the tape under your breast. If it was breast reduction or mastopexy, you will have special tapes. You should change your tapes with the special movement. Your assistant will explain you how and why you can do this. You should be in contact with your assistant and they will give you all information, but it is easy. You will just take off the previous tapes and put the new tapes on your breast. That's it. Again, here you will have any stitches that you need to remove. Here you have only the glue. So you will treat your breast only with the tapes. That's why your rehabilitation will be very fast. Your recovery will be brilliant. Implants do not cause breast cancer. There are two types of complications that could be after breast augmentation, after mastopexy: seroma and capsular contraction. When we put the implant inside our body protected from the implant. So it produces the special capsula around about the implant. Sometimes it can be additional volume, liquid, between capsula and the implant, and it's named seroma. So suddenly 3-5 years after the surgery, your breast, right or left, can be bigger. I recommend, of course, to do the ultrasound, but with the medication it's antibiotics and steroid medications. That's it. Everything will be okay. Some of the surgeons, they do the punction of this liquid and take off this liquid with the syringe. I don't do this. Capsular contraction. Normally this capsula should be thin. If this capsula became thinner, it contracts the implant. So the size of the breast became a little bit smaller. Patient can feel the pain and the breast became more solid. My recommendation: do the ultrasound examination every year after the surgery. And during this ultrasound examination, you should check the thickness of the capsula. If radiologist, but it should be very good radiologist, will see the difference of the thickness after the years, it means that maybe this capsula became thinner and maybe we will need to change the implant. Please send all of this information to your assistant. I should see these ultrasound pictures, and of course better to see the video of the ultrasound. So again, there could be two types of complications: seroma or capsular contraction. With microtain polyurethane implants, the percentage of these complications, we cannot say 0%, but less than 1%. That's why, for my opinion, it's one of the best implants nowadays in plastic surgery. Some of the patients, they thought that asymmetry or the color of the scar is the type of complication. No, it's not type of the complication. We can see that it's aesthetic changes that's not satisfied you as a patient, and all of these things can be corrected after the surgery. Don't worry about it. It can be because of the quality and genetic specific of your skin and reaction to the stitches. If we need correction after the surgery, for example, it is asymmetrical position of areolas or maybe asymmetry of submammary fold, we can correct it 3-5 months after the surgery. Rehabilitation after correction will be very fast, few hours, because all of these corrections we can do by local anesthesia. If we are talking about primary breast augmentation with the implant, or if we are talking about mastopexy. If you want to change the implant, for example, you decided to have bigger implant or another projection of the implant, my recommendation is to do this 1 year after the surgery. For me, as a surgeon, of course, it's better if it will be sedation, because with sedation, the correction will be faster. If we will do by local anesthesia, we're waiting time for the injection. In the beginning, you will feel pain because of the needles, then we need to wait. So during the sedation, the correction much faster. We don't need checkups, offline checkups, next day after the surgery because of my special technique, because of my special instruments, because of the best anesthesiologic team and assistant support. Also, I don't use drains. We don't need to remove the drains after the surgery. You will have special medication and you should be in contact with your assistant. The first online checkup with me can be 6 months after the surgery and then 1 year after the surgery. Of course, it will be great to see you offline. During offline, we can do together ultrasound examination. We can check the shape of your breast, the position of the implants, and if you will need any corrections, immediately we can talk about this. Also, if you will have any questions, we can organize online consultation with me in any time, 1 month, 3 months, 6 months after the surgery. Don't worry about this. Your assistant will be always in contact with you. Very important. I don't use skin stitches. I use the glue. You don't need to remove the stitches after the surgery. That's why you don't need offline checkups 1 week, 2 weeks after the surgery.